of 46.6% compared to Knox County, which has a case rate of 15.5 cases per 100,000, a test positivity rate of 9.2%, and a fully vaccinated rate of 54.4%. Next slide. The next slide compares Shelby County to Hamilton County. Hamilton County is in orange, Shelby County is in blue. Shelby County has surpassed Hamilton County in case rates. Hamilton County has a case rate of 10.9 cases per 100,000 compared to Shelby County's 12.8 cases per 100,000. Hamilton County has a test positivity rate of 7.6% and a fully vaccinated rate of 51.1%. Next slide. And then when you compare Shelby County to Davidson County has a case rate of 14.3 cases per 100,000, a test positivity rate of 6.2%, and a fully vaccinated rate of 58.2%. Next slide. Shelby County continues to have lower active case rates than every other metro area except Hamilton County, but it also continues to have the lowest vaccinated rate of all the urban counties in Tennessee. Next slide. Currently, there are 1,171 active cases in Shelby County, and that is an increase from 924 this time last week. There have been 2,298 deaths over the course of the pandemic in Shelby County. Next slide. This slide shows active cases by age group. We have seen an increase in active cases across every age group except the 85-plus age range. Next slide. This chart shows the percent of active cases among children in various age ranges. The active case rate is highest in our 5 to 11-year-old age range, followed by, and that's in red, followed by the 12 to 17 range in green, with the lowest active case rates among kids among the 0 to 4-year-olds. Next slide. This map is familiar to you, and it shows the active cases by zip code in Shelby County. Darker areas show areas and zip codes where there are more active cases. Next slide. This is a similar slide, but it shows the active cases among the pediatric population, less than 18, by zip code. Next slide. This chart shows the first, second, and third doses by date, with the third doses in darker blue. More than 1 million people in Shelby County have now received at least one dose of vaccine. Our goal is to increase the number of first and second doses in order to meet our vaccination goal. Next slide. Currently, 55% of the eligible population has received at least one dose of vaccine. 46.6% of the population is fully vaccinated, having completed a series of 2 vaccinations of Moderna or Pfizer, or 1 vaccination of J&J. This bar graph shows the population vaccinated by age group, and as you can see, 5 to 11-year-olds have been added to the bar graph, with a little over 5% of that age group being vaccinated here in Shelby County so far. Next slide. Remember, the goal is to have at least 70% of the population fully vaccinated. You see, we are more than halfway there, but we have a long way to go still. We have not reached even 50% of our total population vaccinated yet, but we are hoping that now that 5 to 11-year-olds are on board with vaccination, we will continue to see our vaccination rates rise. This is the end of our slides. Remember that the health department is offering the pediatric Pfizer COVID-19 vaccination for children ages 5 to 11 at its immunization clinic at 814 Jefferson each Monday through Friday, 8 to 4:30, with extended evening hours until 7:30, several evenings per week. The health department is not the only provider of pediatric vaccines. The best way to find a vaccine provider near you is to go to Vaccines.gov and enter your zip code. The health department will provide vaccinations in collaboration with Shelby County Schools this Friday and Saturday. More than 1,000 parents have signed up to have their children vaccinated at this event. And the Whitehaven drive-through vaccination site is also open this Friday from 9 a.m. to 6 p.m. and Saturday from 9 a.m. to 1 p.m., serving adults and children age 12 and older. And with that, I will take your questions.
Abigail Warren, Daily Memphian.
Hi, I wanted to see if there are any enforcement measures that y'all are taking for the schools that have decided to keep masks optional, and if y'all feel like you have that authority with the new law that went into effect.
That's a great question. So as you know, the new law has had a pair of injunctions put up against it in the federal courts. Right now, we have been ordered to continue to enforce our mask mandate as it regards schools. And so we continue to investigate all cases where that health directive may not be complied with.
Are there any measures you can take to make sure that those are complied with?
Well, our investigations include some of those measures, and we are exploring even more options, but of course, I cannot discuss pending litigation.
Sam Hardiman, Commercial Appeal.
To follow up, excuse me, sorry, you would think I would know how to do this after a year and a half. I was on mute. To follow up on Abigail's question, when you say you can't comment on pending litigation, does the health department have authority to penalize a school district for not following the health directive? Yes or no?
So that is not a simple yes or no question, and you know that. So what I will say is, we are in pending litigation as it regards the health directive and the new Tennessee law. With that said, we are in continued talks with Tennessee Department of Health to make sure that we have clarity on what authority we do have and we don't have. And once I have an update for you, I will bring it to this forum.
To follow up, the R0 is 1.07, which would over time compound and lead to exponential growth. Is the health department concerned with that R0, and what does it represent as the state of the virus in Shelby County?
Great question. So anything above 1 means that transmission of the virus is accelerating. We are concerned daily because we look at the numbers daily whenever we see an uptick. But what I will tell you is that that concern is lessened somewhat because we know that a good percentage of the people in Shelby County right now either have vaccination immunity or natural immunity. With that said, natural immunity can be fleeting. And so for those folks who have had a COVID infection but have chosen not to be vaccinated even if they're eligible, they continue to be at risk for COVID infection and possibly poor outcomes due to those infections. And so that's why we continue to highly encourage masks in indoor public spaces, because we know that if you are in areas where you do not know the vaccination status or illness status of the people that you're around, you definitely should be masked to protect yourself. And that's regardless of vaccination status.
Julian Paris, Fox 13.
Good afternoon, everybody. I wanted to see if there was a update on how many children have been vaccinated up to this point, since you mentioned that that is the age group where we are seeing the most increase when it comes to active cases.
Great question. So in that 5 to 11-year-old category, we're sitting at right at about 5%, a little over 5% vaccinated in that age group. And then in the 12 to 17-year-old category, we're seeing about 40% vaccinated, give or take a percent. So with that said, that means that we still have a very long way to go to get that percentage up in 5 to 11-year-olds. There are several events happening Friday and Saturday. So I told you about the Shelby County Schools event. We're vaccinating at 814 Jefferson and have done so since we were able to about a week and a half ago or 2 weeks ago now. And then there are also a couple of events at Glenview Community Center and Hickory Hill Community Center, which is a collaboration between City of Memphis and Methodist Le Bonheur. So there are plenty of opportunities for parents to get vaccinated in those forums, but also remember that all of the big box retail pharmacies have vaccinations for 5 to 11-year-olds. And like I shared before, Vaccines.gov is the quickest way for parents to find out where they can get their kids vaccinated, but there are several opportunities and there will be more.
And as a follow-up, in regards to that goal, that 70% goal that you guys are trying to reach in the county, do you have an idea of how many more people would need to get vaccinated in order to reach that goal?
Oh, that's a great question. You're trying to make me do public math. I'll have to get back to you on that one.
Hannah Gravenstein, MLK 50.
Good afternoon. My first question is, Shelby County has, I think, not even very recently moved back up into the substantial transmission category according to the CDC. And my understanding of the CDC mask recommendations is that counties that are in substantial or high transmission should, I guess, impose mask mandates. And I'm wondering if a mask mandate is, again, near in the future, considering that, as you mentioned, the R0 is above 1, and we can reasonably expect cases to increase.
Great question. As you can imagine, like I shared before, we are in continued talks with Tennessee Department of Health to discuss what steps we can take next given the new law. So if there are any updates on what will be coming given what we're seeing in the numbers, I'll be sure to bring it back to this forum.
So are you, I mean, I know that the last thing that you all said was, highly recommending masks, but now that is there anything more that you can, I mean, should everybody be wearing a mask in every public place right now?
So, Hannah, you know me, so what I will say is what I've always said. If you know that you're going to be in a situation where you do not know the vaccination status or the illness status of the people that you're going to be around, it is highly recommended that you put a mask on. And you don't need the Shelby County Health Department to require that, to know that right now, for the full population, we're still sitting at less than 50%, which means that every time you go out, at least 50% of the people more than likely have not been vaccinated and therefore could pose an exposure risk of COVID-19 to you and your family. And so with that type of information, we like to arm you with information at Shelby County Health Department. So with that type of information, that should inform your practices going forward. This forum has been going on in some form for now 20 months. The public gets a lot of information from the Joint COVID Task Force, and we remain very transparent about the numbers. So I like to tell some groups that they've become junior epidemiologists. So all the junior epidemiologists out in the public should know that if the RT goes above 1, then that means that transmission is accelerating in our community. We still have COVID-19 in our community, and we still have a good proportion of our population that is not vaccinated.
Shay Arthur, WREG.
Hi there. Director, I'm just kind of going off what you just said about still having, COVID-19 out in our community and the transmission rate high. We're a week away from Thanksgiving. How do you recommend people get tested before they meet with loved ones, or what's some of your recommendations for people there?
Yes, I'm so glad you asked me that question. Please, if you are planning on gathering, the recommendation is that everyone should be tested within at least 72 hours of gathering to make sure that you know the status of everyone that may be coming into your home. It got cooler today after a beautiful day yesterday. It's still beautiful today, but it's colder. So we know that a lot of you all will be gathering for the holidays, and it will be so much safer if you know the status of everyone that you're going to be gathering with. with, and so that you can prevent any spread of not just COVID-19, but flu or any other illness that may be circulating in the community.
And then just to follow up, I know you were talking about percentages and numbers and places to go for children to get vaccinated, and I'm sure you feel like a broken record here, but can you reiterate again to parents who might be on the fence about getting their child vaccinated why you believe they need to have their children vaccinated? Thank you so much.
Oh, no problem. And I do not mind sounding like a broken record. You all may be tired of it, but I am not. Because if it means we save lives, then I've done my job. So for parents who are worried about the vaccine, what I would tell you is I would worry more about my child or any child getting COVID and us not knowing the long-term consequences of them being infected with COVID. And so we know that the COVID vaccination is safe and effective. We know that it is very good in the 90th percentile for preventing COVID-19 infection. And I believe that this is the best way to get us on the road to getting out of this pandemic. As you know, we're going to be on a roller coaster ride for a while with numbers going up and then going down depending on our behaviors. And so if we can continue to protect the children in our community by making sure that they're masked, by making sure that they're vaccinated, especially with this new opportunity for some of our youngest children, then I believe that we will be on a much better footing by the time we get to the spring and summer.
Go back to Abigail Warren.
Hi, I just wanted to see if with the holiday next week, if that changes the briefing schedule.
It does change the briefing schedule, so I don't believe that we'll be briefing next week. And then starting in December, we will be briefing every first and third Thursday. And then for the folks who are on the Joint COVID Task Force calls, we will be having those calls on the first and third Fridays. All of this is subject to change if conditions on the ground change.
Sam Hardiman.
Hi, I had another question about childhood vaccinations. So far, about 5,000 kids have been vaccinated. Is that a 1 week number or a 2 week number? And then is the health department satisfied with that pace of vaccinations?
It is a 2 week number because it's up until, I believe, yesterday. And what I will tell you is we are satisfied given that we've only been online 2 weeks. And remember that some of the other providers who are now vaccinating did not get their vaccine as quickly as the Shelby County Health Department did. So really, the Walgreens of the world, the CVS's of the world, they actually have vaccinated even more kids than we have now. So we're so happy that we have a good number of providers in the community who are able to give this vaccine to parents who are ready to take advantage of this opportunity. The other thing I would say is, remember, Shelby County Schools released 1,000 slot appointments for the vaccine event that we're partnering with them to do on Friday and Saturday. Those 1,000 slots were filled up within a day and a half. So that lets you know what kind of demand there is from parents wanting to protect their children from now this 20-month marathon of COVID-19.
Hannah Grabenstein.
I have an additional question about data, and I'm wondering, I might be missing this on the website, but have we seen any increases in the number of, what is the percentage of people who are getting sick or who are hospitalized who have been fully vaccinated with 2 doses?
Oh, great question. So we are seeing some breakthrough cases. I will have to get that number for you as far as how many have actually been hospitalized, but I will tell you that the majority of breakthrough cases are not hospitalized. We have heard from hospitals that said that the majority of people that they are still hospitalizing for COVID-19 are those folks who are unvaccinated.
Abigail Warren.
Hi, I had one more question. I've been seeing chatter about the definition of fully vaccinated changing. Is the health department reviewed that? And are there any thoughts on that from you?
Great question. So for right now, our definition of fully vaccinated remains 2 doses of Pfizer, 2 doses of Moderna, or 1 dose of J&J. But if those recommendations change, we'll definitely take a look at that. We are tracking it as fully vaccinated, those 2, 2, or 1, but we're also tracking how many and what percentage have received those booster doses. And I believe right now we're hanging out at right about 8% of our Shelby County population has received a 3rd additional or booster dose.
Sam Hardiman.
Hi, one more question. What is the health department and joint task force projecting over the next month in terms of case rate and R0, given that we're about to enter the holiday season and this appears to be a seasonal virus?
Great question. So right now we're not projecting what the RT will do because frankly we watch it daily and weekly. As far as case counts, as you know, it really does depend on whether RT continues to go up or if people are extra careful, know their testing status before they gather, and make sure that they're not spreading virus among themselves and in their family and friend groups. We can't really give you a projection right now because really it would be more realistic to wait and see what the numbers do, but also encourage people to continue to stay masked up and most important, continue to get vaccinated if they're eligible and they either haven't started their series or have not completed it. We know that there's a good percentage of people who got their first dose but have not received their second dose. This is the best time to do it ahead of the holiday season.
Hannah Gravenstein.
Please also forgive me if I've missed this over the past couple weeks or somewhere, but I know that some major areas are recommending that everybody get a booster, regardless if they fall into whatever category was originally approved for booster shots. And I'm wondering, has the Shelby County Health Department made a recommendation, like should everybody get a booster if I'm just like a 30-year-old and I got Pfizer?
What we are doing is sticking with the CDC guidelines, and the CDC guidelines have not changed in that regard, but I know that it is being looked at.
Those are all of our questions today. Any closing messages?
The best closing message I can give you is if you have a 5 to 11-year-old and you have not taken advantage of the opportunity to get them vaccinated, please do so. The vaccine for them has only been available for 2 weeks, and there are plenty of opportunities in the community to go and get that vaccine. The easiest and quickest way for anybody who is eligible to be vaccinated that hasn't been vaccinated is to go to Vaccines.gov and put in your zip code and find out where you can go. But also, remember, as we get ready to go into this holiday season, it couldn't be more important to know not only your vaccination status, but your illness status. Make sure that you and your loved ones get tested so that before you gather, you know that everybody is safe. And please remember that we continue to be in this together. No matter what we're facing right now in the community, we are in this together. No matter what corner we live in Shelby County, we can do this together, but we have to keep that in front of us so that we can protect ourselves, our loved ones, and our community. Thank you.
Thanks, everyone. Have a safe weekend and a safe holiday.